All right, so now on to mitral valve prolapse and mitral stenosis. So things we need to kind of conceptualize. Remember, our increased blood is going to lead to increased murmur for everything except our mitral valve prolapse and our hokum. And our mitral valve prolapse is in the scenario. So this is first concept number one, which we talked about earlier. Concept number two is that for mitral valve prolapse and for mitral stenosis, later, so as the murmur occurs later, this is going to lead to softening of the murmur. So later is going to do softening or decreased murmur. So, and remember, for aortic stenosis, later is bad, but how much you hear the murmur is not necessarily based off of is it later, is it early. Has a little bit more to do with left ventricular function for that, but later is worsening of the murmur. For mitral stenosis and mitral valve prolapse, later is equal to softening, which is equal to an improved murmur. So improved. So good. So now we have more blood, more murmur, and later is good, and later is softening. So now if we look at our S1, and then we can go to our S2, which then goes back to our S1. Remember, this is systole, this is diastole. Remember, our mitral valve prolapse is going to be a systolic murmur, so this is going to be mitral valve prolapse. And our diastolic murmur is going to be our mitral stenosis, kind of talking about that stuff earlier. So remember, with mitral valve prolapse, this is going to be a click. And then with mitral stenosis, this is going to be your opening snap. So that means as the murmur moves this way, which will be later, as the murmur moves this way, which will be later, this will be a decreased murmur. So on both of these, the murmur will decrease. And this will also lead to, just kind of overall improvement. So for both of these. So what moves the murmur this way or softens the murmur? So that's when we kind of get into our more blood, more murmur for everything except mitral valve prolapse and hokum. So more blood equals more murmur. So for our mitral stenosis, our murmur moving this way will result in, so increased preload will move the murmur toward S2, and the murmur will get louder. So for our mitral stenosis, our decreased preload will move the murmur toward S1, and our murmur will decrease. So that's for that one. Now for mitral valve prolapse, more blood, more murmur for everything except mitral valve prolapse and hokum. So increased preload. It's going to move our murmur toward our S2, which is going to decrease our murmur. Because remember, more blood, more murmur for everything except. So this is the except. And then for mitral valve prolapse, our decreased preload will move our murmur toward S1, which will then result in increasing our murmur. So hope that kind of makes sense there. This is in words, kind of everything that we just talked about. The only other thing I know to tell you here is that for mitral stenosis, for mitral stenosis, our murmur occurring sooner, so closer toward S2, is going to be associated with increased murmur as well as increased preload or worsening of the murmur, and this is also due to increased pressure. So the pressure gradient between our left atrium and our left ventricle has increased, and that makes sense. So let's say, to do just kind of a quick depiction, this is our left atrium, and we have a single ventricle or a single valve ventricle here. So yeah, not accurate, but so let's say we increase the blood within our left atrium, which is also going to increase the pressure. So this valve is going to be more likely to open sooner. So this valve is going to open sooner if we do all that. And opening sooner, when we look at kind of the continuum of this murmur, So remember our S1 is going to go to our S2. Our S2 is going to go back to S1. This is a diastolic murmur, remember, and that the murmur will occur sooner with increased pressure. So it's going to move toward S2. So remember our opening snap, say it was here, it's going to move this way with that increased pressure, increased blood. Just means the valve is going to open sooner, making that valve occur a little earlier, meaning we hear it a little longer, meaning we hear it a little louder because of increased pressure. Remember, gradients have a lot to do with our murmurs and what we hear as well. So we kind of increase that gradient, increasing that pressure, which is all due to increased preload. So, and then, there's just some things, tachycardia, standing. It's going to decrease our preload, decreasing our murmur here. And then anything that increases preload will decrease our murmur here. So also increasing afterload. So I mentioned that there. The last thing I want to get into is PVCs and murmurs. So when we look at kind of our stuff we need to know, murmurs, that's within all that stuff that all of us need to know, kind of the basic maneuvers. That VSD stuff and this kind of PVC stuff. This is kind of what PVC stuff. This is kind of what I call that 95th percentile stuff. So not stuff you just have to know, but good to know if we're trying to knock the top off of it, which I hope we all are. So kind of going from there, with the PVC, so what is a PVC? It's just an early ventricular contraction. That early ventricular contraction is followed by compensatory pause. So, let's say we're looking at our EKG here, our QRS, our T wave, and then let's say we have a PVC. Remember, it's just a ventricular contraction, so there's no P wave. And let's just say we get our PVC, so it looks something like that. Well, then before our next QRS complex, we're going to have a little bit longer pause. And then we'll just have, our normal, oh boy, that's a bad one, QRS, and then our T wave and stuff like that. So this increased pause. So what's going to happen during that increased pause? So with the increased pause, we're going to have more time for the ventricle to fill. So that's going to lead to increased preload. Does that make sense? More time for the ventricle to fill, increased preload. That increased preload, just due to more blood in the ventricle, by the Frank-Starling mechanism, you're going to get an increased contraction. So we're going to get a stronger contraction with the increased preload, more blood to squeeze out, a little more stretch, and then there's going to be a decrease in our afterload. So that decreased afterload results in just a longer time for blood to kind of run off. So this contraction has happened, blood's been pumped out of the left ventricle into the aorta. Instead of, that regurgitant volume kind of immediately falling back as that valve starts to open back up, there's more time for all that blood to kind of run downstream through the systemic vasculature. And with more blood, more time to run downstream, you get just a little bit of a decreased afterload. So now we want to look at our murmurs and what we have in relation to this. So we have, let's say we have mitral stenosis, mitral regurg, aortic stenosis, aortic regurg, HOCM. One it also likes to mention is our mitral valve prolapse and our pulmonic stenosis. So we have all of these. So with that decreased afterload, remember, and this is, once again, it's not 100% sure, but, you can kind of just look at the individual pieces and kind of try to piece them together. So mitral stenosis. Well, what do we know about mitral stenosis? We know more blood, more murmur. So indirectly, we're going to get an increased preload, increased mitral stenosis murmur due to there just being more blood around. So that's kind of based off the preload principle. More blood, more murmur. So our mitral regurg, it's going to actually decrease, and this is what's kind of been proven to show. So how do we know it decreases? I thought you said more blood, more murmur, but it's based off the afterload here. So our decrease in afterload, so our afterload drops, and remember, blood's going to follow the path of least resistance, and the least resistance at that point in time is going to be through the valve it should be going through, which is the aortic valve. So our mitral regurg will actually decrease. Our aortic stenosis here is going to increase, and this is due through multiple mechanisms. One is the increased preload. So remember, we have increased preload, which is going to lead to the increase in the intensity of the murmur. Also, remember, with decreased afterload, we get more murmur for aortic stenosis. And that's just because, once again, that gradient is increased when we decrease the afterload. So you decrease the afterload, increase the gradient between the left ventricle and the aorta itself, and then so it results in increased murmur. Our aortic regurg, it's tough to find exactly what they say happens on this. It could be you could say it increases because you have increased preload. You could say it decreases because you have a decrease in afterload. I would say it probably stays the same. So just kind of a neutral on your aortic regurg is the way I would look at it. I would also look at mitral regurg as more of a neutral, but that's just me. So, but once again, whatever they, depending on what they ask, that's, you want to answer what they're asking. And the books say that mitral regurg decreases. So HOCM, what's that one going to do? Well, with our decreased afterload, remember that's going to lead to an increase in the murmur itself. And with more blood, you get more murmur for everything except. So remember, the preload should actually lead to a decrease in the murmur. But because the afterload is playing a little more significant role, and remember this is kind of a gradient issue as well, more than it is a blood issue. The HOCM murmur is going to increase, and that's something that they'll ask you. Okay, so remember, something that you might get asked is the aortic stenosis versus the HOCM, and which one does what. So remember, with Valsalva, you get an increase in your HOCM murmur, and with aortic stenosis with Valsalva, you get a decreased in the murmur. Post PVC, they both increase, and that's basically what it'll be getting at. So they'll give you a patient, where they give you multiple physical exam findings, and post PVC, both of those murmurs increase. So, and that is just something that they might ask. The question I've been asked on it is, which one of the following murmurs decreased post PVC? And that was kind of the question I got asked. And one of these was the answer. If I remember right, it was mitral valve prolapse. So remember, once again, this is kind of further on down the line info. But covering our last couple murmurs here. So mitral valve prolapse, remember, it's going to decrease, and it's based off that more blood, more murmur for everything except mitral valve prolapse and HOCM. So we're going to have more blood. That more blood is going to lead to approximation of our left and right ventricle, our two mitral leaflets, and approximation will result in decrease in that murmur. And then our pulmonic stenosis. Our pulmonic stenosis murmur will increase just for the same reason that our aortic stenosis and HOCM murmurs will increase, just providing an increased gradient there. So big things to note, our mitral stenosis murmur is going to increase, but it's going to increase indirectly, just secondary to the increased preload, and that HOCM, aortic stenosis, and pulmonic stenosis, those are the ones that they seem to ask the most about post-PVC, and those all increase. And if you just remember what happens with the PVC, which you get the stronger contraction secondary to the increased preload and the decreased afterload because there's more time to run off, you can pretty much think through most of these. And remember, let's say you get to one where you have one thing that tells you it's going to increase and one thing that tells you it's going to decrease. Look at kind of the origin of the murmur. So is this murmur, kind of a blood flow issue, or is it just kind of a valve gradient issue? Remember, for a lot of your stenotic murmurs, those are kind of gradient issues, as opposed to maybe your more regurg murmurs, which are going to be more like path of least resistance and stuff like that. So look at how the murmur's formed, and then remember, if you have one that goes up and one that goes down, maybe then murmur might kind of neutral out. So that's kind of something to think about. But for your aortic stenosis, remember, more blood, more murmur, preload's going to increase, decreased afterload, that's going to lead to increased murmur. So that murmur's definitely going to increase. So, all right, well, that'll wrap up our kind of murmur talks for this quick murmur review. If you have any questions, let me know, and thank you.